Hey, welcome to The Explainer. Now, if you're a new nursing intern, this one is for you. We are going to cut right through all the noise around infection control. My goal here is to build your confidence and give you some really practical skills you can use, like on your very first day on the floor. All right, so here's our game plan. First, we're going to start with the big why, this whole idea of asepsis. Then we'll get into the core principles, the chain of infection and your protective shields. And we'll wrap it all up with the practical how, the stuff you'll be doing every single day to keep everyone, including yourself, safe.
Okay, let's jump right in with the absolute most important concept, asepsis. Seriously, before we even think about masks or gloves, we've got to get our heads around what we're even trying to do. This is the bedrock of patient safety, right here.
So, at the end of the day, asepsis is the goal. It's that simple. We're trying to create an environment that's free from all those nasty, disease-causing contaminants. But it's not a one-size-fits-all deal. There are actually two key ways we go about this.
And this slide really breaks down that crucial difference. So on one hand, you've got medical asepsis. Think of it as clean technique. This is all about containment. We're just trying to stop germs from spreading, like when you're maintaining an IV line. But then you have surgical asepsis. This is the sterile technique. This is about total, complete elimination. We're talking wiping out everything, including those super tough spores, because we're protecting a patient from the environment itself. Like when you're inserting a Foley catheter. See the difference? Containment versus elimination.
Okay, so we know our goal is asepsis, but to really win this fight, you have to understand the enemy's playbook, right? Infections don't just happen out of nowhere. There's a totally predictable pattern, a sequence of events, and we call this the chain of infection.
So, just look at this chain. An infection absolutely needs every single one of these 6 links to work. It needs the germ, a place to hang out, a way to get out, a ride to the next stop, a door to get in, and finally, someone to infect. The amazing thing is, if you break just one of these links, the whole thing falls apart. The infection can't happen. And that's your job. You are a professional chain breaker.
And this is where you come in. This is so cool. Every single thing you do is a direct attack on one of these links. Sterilizing equipment? Bam, you're taking out the agent. Washing your hands? You're destroying the reservoir. Putting on your gloves and gown? You're literally building a wall to block transmission. You have so much power to break this chain at every single point.
All right, let's gear up. We're going to talk about your personal shields now. The specific precautions you'll use to protect yourself and your patients. Think of it this way. Standard precautions are the shields you use with every single patient, no exceptions. Then you've got transmission-based precautions, which are like bringing out the heavy-duty shields for specific known threats.
First up, we've got airborne precautions. This is for the really tricky stuff. Those super tiny particles that can just float around in the air for a long time and travel pretty far. We're talking about things like TB and measles. For these, your absolute non-negotiable piece of armor is a fitted N95 respirator. And the patient has to be in a special negative pressure room that basically sucks the air in and keeps it from escaping.
Next up is droplet precautions. Now, unlike airborne particles, these are bigger, heavier droplets from a cough or a sneeze. Think the flu. They don't float around. They travel maybe 3 feet and then drop. So here, your shield is a standard surgical mask, and the key is just keeping that little bit of distance. And finally, we have contact precautions. This is for germs that spread by touch, either by directly touching the patient or something in their room. This is huge for what we call superbugs, multi-drug-resistant organisms like MRSA. In this case, your gown and gloves are everything. They are the physical barrier that stops the germ from ever getting on you.
Okay, so knowing which shield to use is half the battle. But honestly, putting them on and taking them off correctly, that's a skill that's going to give you so much confidence. So let's walk through it. Let's master your armor.
When you're putting on PPE, we call it donning, there's a specific order for a reason. It's all about creating the best possible seal. A good way to remember it is kind of from the ground up or body out. You start with the gown first, get that secured. Then your mask or respirator. After that, goggles or a face shield. And the very last thing, gloves. And you want to make sure you pull those gloves over the cuff of the gown. No gaps.
Now, taking it all off, or doffing, is honestly where things can get dicey. This is the moment you're most likely to contaminate yourself. So the order is designed to get the dirtiest stuff off first. Think about it. Your gloves are the most contaminated, right? So they come off first. Then your face shield or goggles. Then the gown. And what comes off last, protecting your airway until the very end, the mask or respirator. and you always want to take that off after you've left the room.
All right, but your job doesn't stop when you take off your PPE. Not even close. The entire environment is part of the battlefield. We're talking bed rails, IV poles, your stethoscope. Everything is part of infection control.
And it's so important to know the difference between these three levels. Look, cleaning is always step one. You can't disinfect something that's still dirty. Cleaning just removes the visible gunk. Disinfection, that kills most of the harmful microorganisms. But sterilization, that's the top tier. That's the only one that kills everything. We're talking every last germ, including the really, really tough to kill spores.
And this table here, this is a fantastic mental model. It's super logical. The level of risk an item poses tells you exactly what level of decontamination you need. So something high risk or critical, like a surgical tool that's going inside the body, that absolutely has to be sterilized, no question. But then look down at the bottom, a low risk, non-critical item like a BP cuff that's just touching someone's arm, low-level disinfection is totally fine. The risk level dictates the method. It's that simple.
Okay, let's pull all these threads together. Why are we so obsessed with all this? What's the bottom line? Well, it boils down to two huge things: protecting you from getting sick on the job and protecting your patients from getting an infection they didn't have when they came in.
Just look at these numbers for a second. This is why sharp safety is not a joke. If you get a needle stick from a patient who has hepatitis B, there is a 1 in 3 chance you'll get it, a 33% risk. That is staggering. This isn't just some abstract concept, it is a very, very real danger.
So, what do? The most important thing I can tell you is that you are in control here. You have the power to protect yourself. This list isn't just a bunch of annoying rules. These are your personal safety protocols. Every single one of these things, especially never recapping a needle, every single one dramatically cuts your risk of a life-changing injury. Finally, one last thing. You're going to hear the word bundle a lot, and it might sound kind of weird, but don't let it throw you. A bundle is really just a simple checklist. It's a small set of things that research has proven when you do them all together every single time, they massively reduce the risk of common, dangerous infections, like infections from central lines or catheters. So, as you head out for your next shift, I want you to take this one idea with you. Remember that chain of infection? Every time you wash your hands, every time you put on your PPE the right way, every time you grab a clean stethoscope, you are personally breaking one of those links. You're not just following rules, you are actively saving a life. So which link are you going to break today?